Um, in those particular cases, somebody will come in, they've already had an MRI, they've been told by their orthopedist or maybe a couple of orthopedists that they need shoulder surgery. Um, I had one gentleman in, well, actually, the gentleman that was in last week that I mentioned, he already had rotator cuff surgery on his right shoulder like 3 times. He's a retired Navy SEAL. So yeah, it's cervical spine fusion, lumbar spine fusion, surgery on his knees, and he's got left shoulder that has he's been told that he needs a rotator cuff surgery, and he doesn't want to do it because he's still active and he doesn't want the downtime of 3 to 6 months not being able to do anything. And so, I kinda mapped out, what it is we did and how it worked and, gave them all, kind of kinda through our process, and what the program was, and he asked what it was, and, I told him it was a $7,600 program, and he was like, "Whoa," yeah, just taken aback, and, you know, by the time most people come in, they already know how much it's gonna be roughly, it's not like they're today's consumer is very informed. They already have done research to know how much a stem cell injection is, for example. But anyways, he came in, he kind of weighed his options, and he's like, "Is this covered under insurance?" I said, "Nope," and it's all self pay. And we went back and forth a little bit, but then he ultimately, I just, the first one to speak loses. So I just, I gave him the information and just shut up, and he kind of waited himself, and you could tell him he was working it through his head, but he was like, "Okay, let's just do it because there's I have no other option." And so he did. $7,000 on the first day, and he's now in our system. He gets his stem cell injection on Friday this week.